Karen, I understand that you have a one day at a time fund here, and I think it was somebody local that started it.
We have a one day at a time fund for patients and family members that may need a little bit of help during their treatment. And what we do is people make donations from the community, and we've received many donations from community members over the last 5 years. And what we do is we put this into a fund, and we buy Walmart cards so that they can it can be helpful in purchasing pharmaceutical drugs, and then sometimes food. And then we also offer patients gas cards, because it can be very difficult to get here on a fairly routine basis. So for anybody interested in donating to the One Day at a Time Fund, just contact the Cancer Care Center, and I handle that.
That's great, and that's what cancer patients live by, one day at a time.
Exactly, one day at a time. And we hope we are offering them hope and help along the way.
All right, I believe in the One Day at a Time Fund. It helps patients, especially during a trying time, and also with the medical bills. I think everyday items that you can get at Walmart is important.
Exactly. And it's a time where there is no routine. Everything is surrounding their illness and getting through that, and that's one of the reasons why it's called One Day at a Time. It's a way that we can help patients with sort of the little things that are not so little at all, the things that really matter.
So it's great, and they can just send a donation right here. Can you give them the address?
Absolutely. To the Cancer Care Center, and it's 27 Industrial Avenue, Sanford, 04073. And if they can just indicate it's the One Day at a Time Fund, and it is tax deductible, and you will get an acknowledgement. And just so you know, we do put it towards 100% towards patient care.
Great, thank you.
Great. Thank you.
All right, now we're back, and I have Arlene Fortier. And Arlene, how are you?
I am fine, thank you very much.
Now, can you please tell me how you got involved with the Cancer Center?
Well, I'm a cancer survivor, and when I was diagnosed with cancer, there was no center. So it meant for people in my situation, which was breast cancer, you had to travel. And traveling at that point, sometimes it's very difficult, because you need not only yourself, but you also need someone who is going to assist you. So after I was actually treated at Goodall Hospital, and I had some fine doctors, and I'm still here. That's 7 years later. With that, I decided something had to be done. So here we are. And there was a group of people that were just forming, and decided that they needed to have something in southern Maine. And so the three hospitals were convinced they should work together, and that happened. No small feat. And we are now standing in the center. So it's a good thing.
Yes, it is. You did a very good thing. And I'm so glad to have you standing right here beside me.
Thank you. I'm glad to be here. Very glad to be here.
And thanks for all your hard work.
Oh, believe me, this was an effort by many dedicated people. And it all worked out.
And it's made a difference to many people.
It has. And it's a comforting place. It's a place that is very hopeful. You don't feel as if you are alone in this. You have wonderful people, a wonderful facility, and great support from all the hospitals. So no one stands alone.
Okay, I want to thank you very much for your time today, and I'm so glad to see that you're doing well.
It's nice to see you, too.
Nice to see you. And this is Fran's, and I want to thank you for watching the show today. It's meant a lot for me to be here, to see some faces that I haven't seen in a few months, and I appreciate all the work they did for me and my husband. Thank you, and we'll see you next time.